Welcome back. In today's video, we're going to focus on cultural sensitivity and how to tailor suicide prevention interventions to fit cultural contexts. When it comes to addressing suicide risk, it's essential to understand that culture plays a huge role in how people perceive and respond to mental health issues. Cultural sensitivity is key to ensuring that our interventions are effective, respectful, and responsive to the specific needs of the individuals we are treating. Why is cultural sensitivity important in suicide prevention? Cultural beliefs, values, and practices can significantly shape how individuals experience and express mental health struggles, including depression and suicidal thoughts. In some cultures, mental health issues are viewed as taboo or even seen as a source of shame. In others, community involvement and family relationships play a central role in managing emotional distress. Understanding these dynamics is essential to developing interventions that are culturally appropriate and more likely to be embraced by the individuals and communities we serve. How does culture influence perceptions of suicide? In some cultures, suicide may be viewed as a moral failure, while in others, it may be considered a tragic loss of honor or a cultural taboo. For example, in many Eastern and indigenous cultures, suicide might be seen as a stigma that could bring shame to the family. On the other hand, certain Western societies may have a more individualistic approach, where the focus is often on the individual's emotional distress. Cultural norms also influence help-seeking behaviors. In some cultures, individuals might turn to family or spiritual leaders before seeking professional mental health care. In others, seeking therapy or counseling may be seen as a sign of weakness. Therefore, understanding these cultural perspectives is vital when addressing suicide risk and creating effective prevention strategies, tailoring interventions to cultural contexts. So, how can we tailor our suicide prevention efforts to respect and align with cultural values? Here are a few strategies that can help. 1. Active listening and respectful inquiry. Start by asking open-ended questions to understand the individual's cultural beliefs and experiences. Instead of assuming, ask about how they view mental health, suicide, and help-seeking behaviors within their cultural context. For example, in your culture, how are emotional struggles like depression or suicide viewed? Who in your community or family would you turn to for support during tough times? What has helped you in the past when facing difficult emotions or challenges? These questions help build trust and create a safe space where individuals can express themselves in ways that make sense within their cultural framework. The goal is to acknowledge their cultural context and incorporate it into the treatment plan. 2. Engaging family and community support. In many cultures, the family or community plays an integral role in providing emotional support. Engaging the family in the treatment process, when appropriate, can be a powerful way to provide support and promote recovery. For instance, in some cultures, family therapy or community involvement in mental health treatment can help individuals feel more comfortable and supported throughout the recovery process. If the person feels that their family or community might not understand their mental health struggles, it's important to explore how you can bridge the gap. You might suggest involving a community leader or spiritual guide who the individual trusts, or you might consider educating the family about depression and suicide prevention in a way that respects their cultural values. 3. Incorporating spiritual and religious practices. For many individuals, spirituality and religion play a significant role in managing emotional distress and making sense of life's challenges. In cultures where religion is central, mental health issues may be addressed through spiritual practices, such as prayer, meditation, or rituals. It's important to acknowledge and respect these practices as part of the individual's healing process. When culturally appropriate, you can integrate spiritual or religious practices into the treatment plan, for example, by encouraging prayer groups or spiritual counseling as a complement to therapy. collaborating with religious leaders to address stigma or promote mental health awareness within the community. This approach ensures that interventions are not only culturally sensitive, but also holistic, respecting the person's spiritual framework. 4. Adjusting communication styles. Cultural differences often influence communication styles. For instance, in some cultures, individuals may feel more comfortable with indirect communication, while in others, directness is valued. Understanding communication preferences helps you connect more effectively with the person and ensures that they feel comfortable sharing sensitive information. If someone is hesitant to speak openly about their emotions or suicidal thoughts, it might be helpful to introduce alternative methods of communication, such as writing down thoughts or feelings, using metaphors or storytelling, which may feel more comfortable in some cultures. 5. Collaborative decision-making. Cultural contexts often emphasize collective decision-making rather than individual decisions. It's important to include the individual's family, community, or cultural leaders in the decision-making process when appropriate. This can help build a sense of shared responsibility and ensure that the treatment plan is more likely to be accepted by the individual and their community. Reflection questions. How can asking open-ended questions help you understand the cultural context of an individual's suicide risk? What role does family and community involvement play in the recovery process for individuals from different cultural backgrounds? How might integrating spiritual practices help someone manage depression or suicidal ideation within their cultural context? In summary, cultural sensitivity is an essential aspect of suicide prevention. By tailoring interventions to the individual's cultural values and beliefs, we ensure that treatment is relevant, respectful, and more likely to be effective. Understanding the cultural context, engaging family and community support, integrating spiritual practices, and adjusting communication styles are all key strategies in suicide prevention. In the next video, we'll discuss community support, exploring how we can leverage local resources and networks to prevent suicide and reduce stigma around mental health. Let's keep it going, and I'll see you in the next one.